All right, I am now the host. I got it back. There you go, Dr. Alter.
All right. Can people see that?
Yes.
All right. You can see that?
Definitely get lead.
All right, good. So this is Dr. Stephen Monona, who just graduated from our program. And he's known for famously, when asked what to do for an open fracture, asking what the first thing to do, he said in his response to get lead, which is not the correct answer. But as you all will see, when you're under pressure and you're asked questions that are meant to be simple, sometimes you give very stupid answers. And even very smart people that are very good at their jobs give stupid answers. So don't take it personally if people laugh at things you say. All right, so we're going to go through my 10 rules for how to be a good medical student in our service. And these are not watered down. This is what the real expectations are of you, not what the registrar says the expectations are of you on the objectives of your rotation. So first and foremost, don't be late. Med students should strive to be early. Early is considered on time is late. Arrive 10 to 15 minutes early every time. If you are a person who tends to sleep through your alarm, you either need a better alarm system or you need to get a second alarm. And the same goes for while you're on the job. If we're in between OR cases and we tell you to go eat lunch, that doesn't mean go eat lunch for an hour and then come back when you want to. You know, we still have a job to do. So eat lunch because you deserve it, and then come back when you're done and we'll get back to work. You know, if you show up late one time, no one's going to fault you for it. If you make a habit of it, it's going to be noticed. Second rule, and just as important, is don't be lazy. We want hard workers. We all know that you're very smart people. You would not be where you are today if you were not. So trying to impress people by how smart you are is less important than impressing people by how hard you work. You should want to fight to be able to do things and get experiences, not to get out of doing things. If the residents are asking you who wants to go cover this case, the correct response is, oh yeah, I would love to cover that case, not, oh, I don't really want to. Can you do it? You know, you're all supposed to be here because you want to do orthopedics and you want to learn as much as you can about it. So if you are not putting yourself in a situation to be able to do that, then we're not going to take kindly to that. And, you know, being a med student, you're almost at the end of your path to being a doctor, but that does not mean that you should feel entitled to not do the little tasks. You know, when you come into the operating room with Dr. Sahabian, for example, or the orthopedic trauma surgeon, you'll see him taking out the trash at the end of the case to help get the turnover going faster. You can get blankets for the patient. You can roll patients to X-ray in the emergency room. There is no task that is beneath you. And unless someone's telling you to do something illegal, then obviously do not do that. But anything you can do to help is a good thing. And we notice when you do the little things. There should also never be a time when you're doing nothing. You know, if you're eating lunch and you want to check your phone, that's fine. But if we're in a case and maybe you're not scrubbed into the case, you should be watching the case. You should be, if you're on your phone, you should be reading about the case. If we are in the call room and nothing's happening and you're not sure what to do, read about the cases we saw, read about the consults that we saw, ask your resident that you're with if there is any resources that they think that you should read. You know, these months that you spend with us are opportunities for learning that you'll never get again, and you should take advantage of every minute. All right, rule number 3, we want you to identify patterns so that you can anticipate the things that are going to be helpful. We don't expect you to come in on day one knowing what to do. We anticipate that you'll know nothing and that maybe you've seen some of these things, but we don't expect you to know how to even be helpful. But a lot of it is about pattern recognition, and you're going to be on our services for a number of weeks at a time. And we tend to do things in a consistent way. And if you are paying attention and able to identify which things we do when and help to make sure those things happen, then that will be more helpful than anything. So for example, we use the same supplies for our splints. Every time we do a sugar tongue splint, every time we do a short leg splint, we use the same supplies. And you might see us do one or two of them, or you might see us do 6 or 7 of them. But every time we do a splint, you should take note of what we're grabbing and what we're using. And then the next time we do one, you'll know what to go grab for us, and that will be extremely helpful. Also, each surgeon sets up their operating room differently. And, for example, Dr. Sahabian will use 2 ABD pads soaked with alcohol to clean every patient's extremity for every case. So when you identify that and you have those ABDs ready with the alcohol in hand, that's something that we'll notice. So going along with pattern recognition is being prepared. And we do not expect you to know this out of the gate, but we do want you to try as much as possible to prepare for the cases the day before. And it's okay to ask your senior resident or any resident that's on your service if they know what cases are going to be happening the next day, so that you can try to prepare for those cases ahead of time. And as much as possible, those residents will try to teach you a little bit about the surgical approach that's going to be used, and that there are specific things in that approach that they think that you would be asked about. Resources for you guys, which we've talked about a bunch. OrthoBullets is the Wikipedia of orthopedics, which is the most popular resource. It's the quickest one to use. There's an app for it. And it's very, it covers a lot of topics. It's not the most complete resource in terms of learning about these topics, but from a med student perspective, it's a great way to get the quick and easy rundown. Hoppenfeld's is a textbook that's all about surgical exposures and the anatomy therein. You can read De Palma's anatomy book as much as you want, but nothing beats seeing the actual surgical approaches that we use, because when you're in the operating room, you have a very tiny window to see this anatomy, and it's not the same as looking at it with all the skin cut off. AO Surgical Reference is also a very good resource. You can use it to look up based on the type of injury, what kinds of cases are possible. And then they go through the approaches, the technical aspects in a very easy to understand way. And then as Dr. Ishmael just showed you with some of his lectures, the OTA has some core curriculum lectures on their website. I think they have about 100 now on the basics of orthopedics through like any type of topic that would be useful for you. And if you go onto their website and look through some of their stuff, it could be really quite useful. Really, the only facts that we will expect you to know on your sub-I rotations is about anatomy. That's 95% of what you'll get pimped on. And the other stuff that you get pimped on is mostly just to teach and not really to see if you know it. But we do expect you to prepare for the anatomy when you know what cases you're going to be doing. And like I said, Netters is good for review of your anatomy, innervations, blood supply, etc. Hoppenfeld is really good for knowing what important structures you're going to be near. And, if I had to pick one, Hoppenfeld is probably going to give you the most pimp-worthy question answers. So we always encourage you guys to ask questions, but don't do it just for the sake of asking questions. You don't get a brownie point on your application just for every question you ask. You should be thoughtful in your questions. You should think of them before you say them, and try to ask higher level questions. If you point at something and say, "What's that?" most likely the next response you're going to get is, I don't know, why don't you tell me? So think about the questions that you're going to ask ahead of time. When you're preparing for the cases, you should be thinking about, what's interesting or controversial about this case, and maybe I don't understand this one aspect that I could ask about. Questions to avoid other than what's that is anything inappropriate, like how much do you bench press? What are your thoughts on any controversial political topics? You might hear some of the other residents or attendings or nurses talk about it, but if you want to stay out of the conversation outside of the operating room behind your backs, then you should definitely try to avoid those topics. Decent questions to ask. Is there anything I can help you with? Is that structure there the superficial peroneal nerve, or is that the FCR tendon? Better questions are to make it a little bit more of a thoughtful question, where instead of just saying, is there anything I can help with, try to think of specific tasks that you can be helpful with. Like, can I get the supplies for your splint for you? Would it be helpful if I wheel this patient to the x-ray for you? And etc. So, we all understand that you don't know everything, but one of the best ways to show us that you're thinking actively is to ask good questions. All right, this one sounds a little blunt, and I'm sorry for that, but we want you to complain about things of substance. If anything inappropriate, illegal, unsafe occurs, absolutely complain, report, tell Dr. Gatt, tell your senior resident, make sure somebody knows about it. We take that seriously. And there have been consequences in the past for people that do not take it seriously. But you're going to be with a group of people who work exceptionally hard and exceptionally long hours. So if you come in the morning and you complain about how tired you are, or you start talking about staff members or especially residents and start, gossiping about stuff, you're not going to be held very high regard. So just keep in mind, who you're working with and the level of work that they are doing. And if you're going to complain, I would recommend keeping it amongst yourselves. Very important, do not be a show-off. We all want you to demonstrate to us how hardworking you are and how much you prepared, but don't make other people look bad when you are trying to show that. You need to remain a team player, stay humble, don't steal questions from other med students when it's not your turn. Don't boast about getting an answer right or doing something in front of other med students. Don't tell other med students or other staff members what to do, which might sound self-explanatory, but it's something that happens all the time. And don't act like you're God's gift to mankind. You guys are all in this together. You need to be working together and lifting each other up. You don't want to be the person that looks like a show-off and puts people off the wrong way. Every day, the residents determine when you get to go home. When we tell you to go home, it is not a test. We're telling you to go home, A, because you need to go home because it's illegal for us to keep you too long, but also because we know you need to prepare for stuff the next day. And sometimes there's just not anything for you to do anymore. We don't want to work you so hard that you can't function the next day. That's not what this is for. So obviously be polite when we tell you to go home. If you have any follow-up questions from the day, that's a good time to ask us. If you have questions about what's going to be happening the next day, that's a good time to ask us. If you have specific tasks that you think you could help us with on the way out, then that's a great thing to offer, and we really appreciate that. But no one's trying to trick you here. And the same goes for if you take call with us overnight and we tell you to go to sleep or go get some food, you need to take us up on that offer because you're not going to get that offer twice. It's really about your safety and about making sure that you have the mental capacity to actually appreciate what you're doing on this rotation. My last rule is to help each other out. I've seen programs where the medical students do not communicate with each other at all, and they don't help each other at all, and it's all for one and one for all. And believe me when I tell you that that doesn't make good residents, it doesn't make people that are appealing to residency programs. And there's so much information that you guys will learn individually that would help each other, and being open with each other about your away rotations, the application process, interviews, etc., will make you all better applicants. You will all do better in this process if you share your experiences than if you try to fly solo. So something you pick up if you work with Dr. Levy long enough is that he always says, do as I say, not as I do. You know, if you follow the rules that I've given you today, I promise you, you will be successful and you will match. You will see that a lot of people, including residents, attendings, nurses, other ancillary staff members, do not follow these 10 rules, including myself sometimes, but that is not an opportunity for you to mimic them. It's an opportunity for you to set yourself apart. And obviously, at any time, if anything does not feel right, you should not be doing it. So just to conclude, a summary of my 10 rules. I can email this out to people if they're interested. And then there's also an email address for anyone who has questions that they don't want to ask in this format. That's all.
I got to say, Todd, that was an amazing talk and something that I think we all wish we had gotten as med students, because a lot of times you learn this, you know, on the go, and sometimes you learn it painfully. If you feel like you've done something wrong as a med student, you should apologize once, but if you apologize more than once, that's too many times, because we move on very quickly from things. And the person who apologizes too much is standing out as somebody who's trying way too hard. We want you to get back to work and do your job. You're going to make mistakes. You're going to learn, and learn from each other too. This is a team sport, has to be played as a team sport. And if you're not a team player, it's going to be very obvious. We're not telling you this to make you worried. We're not telling this to make you think we're mean. We're telling you this because this is a hard job. And if we don't follow these rules, it gets uncomfortable and it gets hard. Sometimes the resident needs to do work by themselves. And when they tell you to go to sleep, that they're telling you that they are ready and they're tired and they have work that they need to do. And they may not be able to teach you after 2 a.m. because they still have to work for 3 more hours, and they're telling you to go to bed so they can actually get the stuff done they need. And so you have to respect that when that comes up. Okay. With that said, we love having you along for the ride with us, and you make it better for us by being around. And you're a great group of students, and we can see that already. But it is really important to internalize these rules, and they will become even more important when you become a resident next year. I think the best advice that I ever got, and that I try to give people, is when you become a doctor on day one and put on that shiny white coat and a badge that says MD behind it, and you try to show up the nurses on the floor in your first week as a resident because you think you know more than them, guess what? They've been doing this for 25 years and you've been doing it for 2 hours. And they know a lot more than you. And if you show a little bit of humility and understand that, they will understand that and they will teach you and you will learn. This is a team sport. You do it together. And that's why these rules work. And I don't think Todd could have said it any better. I don't think anybody could say any better than you said it, Todd. I would say that Dr. Cott, who was 2 years ahead of me, helped me to learn a lot of these, and he lived it and walked the walk. And you had to be on time, you had to be ready. And he said, don't miss any learning opportunities that you had there. You know, and what he taught me was to prepare for conferences by reading stuff the night before. And you won't get it all the first day. You won't get it all the first week. You're not going to get it all in 3 months, but you'll start to figure out how you get yourself ready and how you play on the team. Dr. Stelmach, you want to add anything?
Not sure there's too much to really add to that talk. It's pretty good, Todd. But yeah, I think just always be available to help. The more that you're available to help the intern, and you know, learn things on the floor, the better. And just follow all of Todd's rules.
Yeah. And when there's a big group of students around, you know, sometimes that can wind up being a little bit overwhelming. And sometimes you have to know when to sit back and be a little bit passive as a learner. And sometimes you have to know when to step forward and ask those good questions that Todd was talking about. I'm going to send you guys out the SNAPS parameters that I talked about the other day in one of our sessions. I think it's a great way to think about being a proactive student. Some of that applies to when you're interacting with an attending in the clinic. But like I told you the other day, I want you to go at this like you're trying to act like a resident. You're starting to form an identity that I am a diagnostician. I'm gonna report what I know. I'm not going to report too much. I'm going to report what's relevant. I'm going to try to be an interpreter to give them an idea of what I think is going on. I'm not going to be afraid to get it wrong. That doesn't mean I'm stupid. That means that I'm thinking and I'm expected to get it wrong. You don't know what you don't know right now, but if you don't show us what you do know, we can't help you get to the next level. So our advice is don't shy away from challenges, step up to challenges and be ready. And that's how you're going to succeed and get the most out of the next few months. Okay. Brian, you want to add anything, Dr. Cott?
I really don't have much to add. I mean, I thought that was just an excellent talk. I mean, we really have terrific residents that come out of this program. And, not only are they smart, but they're very capable. And, it's just a good group of people. And I think for the med students on that are listening and the ones that are listening maybe later this year or something, if this comes out, I think just being part of the group, fitting in is so much more important than, showing that you're the top of your class and you know everything about everything. Don't show the residents up, because they're tired, they're working hard, and, just be their friend and get along with them. And I think you're going to do just fantastic.
Yeah. And I think that to wrap up, what I think has been just a great week, and it's been great because of all your engagement. It was just so much fun to work with you guys on Monday and Tuesday and do the labs and then to do the talks this week. We are throwing a lot at you and we can tell that you're taking it all in and internalizing it. But next week you get to put it to work. So I think it's like Todd said, being on time is showing up 5 minutes early. You guys should definitely reach out to your the residents of your that are signed on your service. We want to get that out to you via email tomorrow. I'll make sure that happens. I'll work with the chief residents to make sure each one of you knows where you're supposed to go on Tuesday morning when you show up. So that means you're going to show up at a hospital ready to go, usually at 6 a.m., but you should check in the night before with the chief resident or the resident on call, or we'll find a way to let you know what time they're going to round. And you should show up and be ready to go, and you're going to jump right in and go to work. All right.
By the way, there's no pre-rounding, so don't worry about that.
Yeah, everybody shows at the same time here. All right. So I want to thank you all for participating in our boot camp. This concludes the program for the week, but now we get to go have some fun together. All right. So you guys all have a great holiday weekend. Be safe, and we'll see you bright and early on Tuesday morning. Okay.
You too, Dr. McFarland. Thanks for organizing this.
Thanks for being a part of it. I think this was a team effort. Everybody took a part in putting this together. There were a lot of great ideas that helped to get this going, and I had a lot of help. I really appreciate Dr. Alter and his residents who were out on Monday and Tuesday for our live sessions, and who came out, almost all of them, on Monday night to meet you guys at the restaurant and get a chance just to kind of have some fun and enjoy some fresh air. And, just kind of look at what the camaraderie is in this program, because what you saw there is very real. This is a family and a small residency program. You can't survive if you're not part of the family. You got to get in, you got to stay in. So we go do it together. All right, guys. So go have a great 4th of July. Stay safe, and we'll see you on Tuesday. I am away next week. So if any of you try to reach out to me, I am going to be off the grid starting Saturday morning. So your point people are going to be your faculty advisors. For those of you who are my mentees, please feel free to work with the chief residents. You can reach out to Dr. Gadd or Dr. Monica if you need anything, but I'm going to be a little bit unreachable. But if you email me, I will find my way to get back to you, but it may take me a day or two. So, Todd, thanks. Thanks for taking us out of the tunnel, man. Let's go play ball. Play like a champion today.
All right, everyone have a good holiday weekend. Come on Tuesday, ready to go.
All right, guys. Thank you.
Thank you, guys.
Thank you.
Thank you.
Thank you.